Hey, it's Dr. Brandon Pettke here. Today I'm going to talk about one of the most common things that we see here in the clinic, and that is neck pain. A lot of patients come to us, they're dealing with neck pain, lower neck / upper back pain. And so I want to discuss a case today that came in recently, a new patient with this exact thing. And this may be you or somebody you know, but he was having neck pain. It was kind of on and off. It was kind of bothersome. It would flare up for a day or two or three and then go away for a week or two and then kind of flare up. And it was kind of annoying when it would happen. But then he was working out one day and felt a pull, and the next day he woke up and basically couldn't turn his neck, had a searing pain back between his shoulder blades and all kinds of neck pain. And he's like, gosh, it wouldn't go away after like 3 or 4 days. And so he came in here and we did all the exam and x-ray and stuff. And so I want to discuss it because it's a common thing that happens to people. They come in here and really common on his particular x-rays, which I'm going to show you here in a second, is what I see with a lot of patients. And they go and they take medications and they take Tylenol or prescription and stuff, and that never really addresses the root cause of what's occurring and why they're having the pain. And so I want to show you why a lot of these individuals are having the pain and why we've had such tremendous success over the years with these patients. So if you want to come up here, I want to show you a normal x-ray first. If we look at this x-ray here, you will see a couple things I want to point out before I go to this individual's, the new patient's x-ray. Is number one, the patient, this is looking at their neck from the side. They're facing that direction there, okay? The first thing I want to point out is notice this nice smooth curve, okay? When we look at the neck from the side, it actually should have a curve. What that does is that displaces the weight of the head more evenly across all these joints. And so there's not as much pressure down here on the lower joints, all right? The other thing I want to point out is there's 7 bones in the neck, all right? The very top one right here, if I come to the middle of that and I drop down a gravity line, okay, that 7th one, you can see it goes right through it. So the center of gravity is right on top of each other, okay? Now I'm gonna have you step back. Let's discuss this patient. So as I said, he was, kind of coming and going, and then, all of a sudden it just flared up on him one day, which I hear that with so many patients, right? So come on in here, look at his x-ray. So remember I talked about the curve before. You can see he has lost that curve. So remember I said that curve should be like here, right? He doesn't have that curve. So what's happening is without that curve, all that force is being put down to these lower joints. On top of that, you can see this very top bone, as we talked about, when we drop it down, okay, he's about 1 inch forward from where he should be on that 7th vertebrae, C7, all right? So if you, what the significance of that, not only the straight of the neck, putting all that force down on the joints, on the disc, all that extra soft pressure on the soft tissues, and then subsequently irritating the nerves and causing the pain. But when your head is out forward, this is one of the things I want to discuss, is when your head is out forward like that, and you're walking around doing life that way, the head weighs about 10 pounds, give or take, okay? So for every inch that it's forward, it feels like another 10 pounds that your muscles and your body has to hold up. So his is out about 1 inch forward. So he felt like he had to carry around a 20-pound head. That's what it felt like to his muscles. So think about it. Like if you held a bowling ball here, right, versus a bowling ball here, what's going to happen to your muscle? It's going to get more tired out here, right? Well, he's literally doing life like that. And I'll show you posturally. I'm going to stand up so you can see. This is what happens. Let me turn this off. This is what happens with so many people. Their posture first starts out with their head forward, okay? And then what eventually happens is their shoulders kind of roll forward. Females really don't like getting what's called the Dowager's hump, where they get the hump. It's because of this posture stuff, all right? But people, their head goes forward, shoulders go forward. If it gets too far forward that way, what they do is with their pelvis, that goes forward, and then they go more and more like that, and they eventually bend their knees, and then you see the old person walking around like that, right? So that's what occurs posturally. So he's already on that road. So he doesn't have the proper curve in his neck, and he doesn't have the proper posture. So what is that going to result in? Well, guess what? It's going to result in neck pain. It's going to result in that upper back pain, whether it's that burning type sensation between the shoulder blades or it's like a knife jabbing type pain. That's exactly what he experienced. That's what so many of our patients have experienced. So what we do is we take a different approach. Instead of giving you something to take to cover up the pain or mask the pain, we address the root issue of what's going on. And we do that with a combination of things depending on what the patient needs. We, of course, utilize modern chiropractic care. We can use gentle techniques for patients, and if you don't like being popped or cracked or you're afraid of it or whatever, there's different techniques that we can do that we can start getting those joints moving and functioning properly, all right, without having to twist your neck or pop your neck. Those that like the popping and cracking, we can do that as well. And then what we do is we start working on bringing that neck back, getting that curve back into that neck, and also strengthening up those muscles and improving that posture so they don't age, as I showed you before, and obviously it gets them out of pain. And because we address those root issues that are at hand, guess what? We have a really, really high success rate, a little north of 93% with neck pain. So anyway, that's how we approach it. That's what's a lot of times going on with patients, because we do so much stuff on our phones and our computers and everything else. And think about it, like how many pills can somebody take to correct that? It's not going to correct it. A pill's never going to correct that. How many injections, if they go pain management, how many injections can they do to have to correct that? It's not going to correct it, right? We have to, if it's a biomechanical change, we have to use a different set of tools to improve the biomechanics or how the body moves. And that's exactly what we do here in the clinic with our integrative approach. So anyway, if you are suffering with neck pain, or you know somebody that's suffering with neck pain, have them give us a call. We'll go ahead and get them checked out. We can examine them and we can find out exactly what's going on and if we can help them or not, and we'll let them know. So anyway, hopefully this video was useful, and I hope you have a wonderful day. Take care.